Good morning to those that are joining us via the Zoom meeting or via Facebook Live. This is Lisa Hurley with York County Development Corporation, and I would like to welcome you to the York County Community Sector Briefing on November 12th, 2020. As a reminder, this is streaming live out on Facebook. We will also have a recording available later on. I would like to start the meeting by introducing Laura McDougall, the Executive Director with Four Corners Health Department. Laura, floor is yours.
All right, thanks, Lisa. We are seeing more and more cases now in Nebraska, and I am actually always very interested to hear what the hospitals are experiencing. It's in our schools. It seems to be turning into more of a day-by-day situation again with the numbers of people that are ill and how it's affecting all the partners in our community. In the past 7 days in the Four Corners district, so this is district-wide, we have seen 433 cases. In the last 14 days, we have seen 852 cases. So those are large numbers, and we're seeing a lot of everyone at this point probably knows someone who is either has COVID or has had it in the recent past. I think one thing that to keep in mind, and I like to talk now about these past 7 days and 14 days, because we're seeing that many people who become hospitalized often don't become hospitalized till after that 7-day mark. So those numbers mean a lot to us. Those are the people who are experiencing active illness and are at risk of becoming hospitalized. And so that is why we're really concentrating on those numbers right now. So each county within the last 7 days, we have some totals. York County, in the last 7 days has had 126 cases. So that's just in the last week. Seward County's had 196, and Polk County has had 49, and Butler County's had 62. So those are large numbers. Yesterday we had 82 new cases in our district, and we're sitting at 2,407 as our total number across the district for a cumulative number for this whole pandemic. Our total number of people in our county is close to 45,000 people. So you can see when we're at 2,400, we're not nearly, at least with our lab confirmed positives, there's a lot of people yet who are susceptible to becoming ill. Right now, with the ages of people that are becoming ill, we're seeing it, it's pretty evenly distributed across the board. The people in their 70s and 80s still are the people who we've been, doing everything we can as communities to try to cocoon them and protect them. They do still have the lowest number of people who are ill as we're going forward, but we are seeing 70s, 80s, 90s, and I think we've had someone in there that's been 100 that's been ill, but we see the highest hospitalization and mortality in those age groups. So that is important that we do protect those age groups. Our risk dial at this point has now moved to red. We are at 3.0, and today we're going to reset it again. But for the past week, we have been at just border into the red at 3.0. And what that means is that we're really recommending that people stay. Again, it's so important in where we're at on our risk dial that people realize that if they're ill, if they're having some symptoms, they need to stay home and get a test. We need to, and if people are quarantined, and we have a lot of people out there who are quarantined, if it's possible to have them work from home, that's best. We realize some people in critical infrastructure there's an allowance that they may go to work while they're in quarantine, but it's really best because many of those people who are in quarantine are developing illness. So keeping them at home is always the best thing. We've been having a lot of questions about the upcoming holidays. Thanksgiving's in a couple weeks. Really with the situation that's going on right now, just want to promote the idea to keep your gatherings small. Especially consider who might be coming, and if anyone's at risk, really take that into consideration as you're planning your holidays. We've had new directed health measures issued that went into effect yesterday, Wednesday. And in those directed health measures, we have changes in there for many of the, we've kind of gone backwards in our phases again. So had to tighten things down a little bit. We have some changes in there for restaurants and bars, churches. Indoor gatherings are now at 25%. Groups, and this is part of what is affecting restaurants and bars, is that you keep your groups to 8 people at a table. Churches, you try to keep people in household units, and you need 6 foot of separation between the different groups. So there are some changes in there for everyone. So they're posted on our website. So take a look if you need to. We have great amount of testing going on in the hospitals. I'm sure we'll talk about that, our medical providers. I want to take a minute. Tom, are you on? Would you like to give just a real quick update on personal protective equipment situation?
Yeah. So as far as the PPE is concerned, it's still, we've done a pretty good job up to this point of very much filling your orders as best we can. However, like I've kind of been echoing and saying every week, is there still very much is a shortage. Even though it's not in the news cycle and it's something that's kind of been pushed out, the shortage still exists. And I can tell you from personal experience, my wife, it is starting to hit other industries who also use PPE, like the research side of things, that they're not going to be getting their orders fulfilled from vendors moving forward. And so, especially with the biggest thing coming down the line is still the gloves. If you can figure out ways to reduce usage or reuse or use them longer, however, then that's going to make it all the better as we move forward. But like I said, we've been lucky up to this point to be able to mostly fulfill orders, and just kind of again keep in mind that we're kind of at the mercy of what the state and what the national stockpile look like of what we can redistribute out to you. So a little bit of grace and understanding, and we'll get through this together.
All right, I think that's all that we have. Again, we're just asking people to continue to just do those same. We're pushing again, repeating ourselves those recommendations on wear a face covering when you're out, please. Wear that face covering, and keep your distance, avoid those confined spaces, and just be mindful of what your own symptoms are, get a test, those types of things. So thank you. I'll wrap it up here then. Thanks.
Thank you very much, Laura and Tom. We appreciate that the update from Four Corners. We will move on now to the medical sector. Henderson Healthcare does not have an update to provide today. Jennifer with York General, are you available now?
Sure. Good morning. So a few things to note here for York General. Our York General and all campuses are going to be on visitation restrictions. We're going to be at red. We are also going to move Willowbrook to a red situation just because of the positivity level. So we will also be slowing down and closing visitation to Willowbrook. Questions about that, you can reach out to Willowbrook themselves or give us a call later. I don't have all the details right at this moment. Our outpatient drive-through testing continues this week. We test Monday through Sunday now, just to alleviate some of the pressure on Mondays. We have had to add in weekend testing, and we are doing 2 test times on Mondays. From Monday, November 2nd to Monday, November 9th, we did do 189 outpatient tests with 67 positives coming through there. Also yesterday, we tested 201 through our Test Nebraska drive-through. I don't know the positives that came out of that. Last Wednesday, we tested 152, so that number continues to rise fairly rapidly. For our ER census last week, we did have 10 COVID positive individuals that were able to be sent home. They were getting better. We did also have another additional 4 COVID positive admitted and 1 transferred to Bryan. Med-surg floor had 6 COVID positive patients admitted and 6 discharged home as well. We also had an additional 2 that were admitted and transferred to Bryan West. Currently, I think we're sitting at 10 inpatients today with no COVID positives on the floor, so that's a great day. We are still giving our admitted resident patients remdesivir, convalescent plasma, and dexamethasone when they're in for COVID-19 treatments. A couple other things of note, we do have 3 COVID positive patients in home health. So those are COVID positive patients we are treating out in the community. And we have 2 COVID positive patients in dialysis. 1 is currently in our isolation area and 1 has been transferred to Lincoln for additional treatment. We are going to, even though we have no COVID positive patients on our floor right now, we are going to continue to keep the East Hall, the 140 East Hall, closed and held as a negative pressure hallway. It's just easier to keep it that way right now in case we do have more than 4 COVID positive patients. And we are evaluating our elective surgeries every day. So if we should continue to get really, really full and really, really busy, elective surgeries will be one of those things that will have to be looked into further. The ER has been very busy. I believe we saw midnight census of 16 last night. Of those, there were several COVID tests conducted. I don't have the results of those yet. Otherwise, our Hearthstone, currently we have 3 out of our 6 neighborhoods in the yellow zone, and we do have 1 in the red zone due to resident positives. And we are working with several staff members who have also tested positive that are not working at this time, obviously. We are still continuing our social media efforts to slow the spread, stay home, wear your mask, wash your hands, and do all those great things. But we are seeing a continued large increase in the COVID-19 cases and number of quarantine staff at York General at all campuses. So it's still out there. So if you guys have any other questions for me today.
Thank you, Jennifer. We appreciate the update. And as a reminder, at any point when you guys have questions, please put them in the chat. We are keeping an eye on those and we'll direct them, get them answered. We will move on, unless anyone else has something from the health sector, we will move on to the education sector. Mitch, are you available from YPS?
Yeah, good morning, I am. First of all, if you don't mind, Lisa, I'd like to talk about something non-COVID and positive. I really
that would be great.
Okay. I see Craig Vincent's on here. I believe he is, and I want to give a big shout out to NPPD and all their workers. They were a huge help to us Monday morning. At one point in time, our elementary, I was up early and felt like we could have school and felt like that was a good decision to get kids in and warm buildings and so on. And all of a sudden we were out of power at the elementary, which is always interesting, especially with elementary students. And talked to Craig immediately. They were on it and kept me up to date as they went. And we're fortunate to have good people there. So I want to give a shout out to NPPD. Switching gears. Obviously we continue here at York Public Schools to have within our school population low positive cases. Still today, we had an update last night, still today, that we are below 1% of our total population. And so that's a good thing. And so that, as we continue to work with Laura and her team, we continue to work together and feel like that schools in general are safe places to go. And a lot of that is just the teamwork and everything that we're doing. And so we want to continue to keep our doors open, and we will continue to keep our doors open. There is no metric or determining number that we have been told really by anyone of this is the time that you close, or this is the time you do that. And that's frustrating on the school end of it. But I will tell you that our conversations with Laura and a couple other public health people, they've been great about helping us work our way through that. But that is one of the frustrating things on the school end of it is nobody there is, from the governor or from the Department of Ed. We're not hearing of, here would be the determining factor. And maybe that's impossible for them to do, but that's just one of our frustrations. But, YPS, we evaluate our numbers daily to help us determine what steps we need to take. I want to dismiss a rumor that I have heard here the last few days, just to make sure we're all on the same page. Oops, sorry about that. The rumor is that after we dismiss for Thanksgiving, that we are not coming back at all, and that is simply not true. I will tell you that where that could have come from was maybe 3 months, 4 months ago. I don't know. That was a conversation that I know that I was having, because that was as we were seeing colleges and universities make some decisions. There's several that are, once they leave for Thanksgiving, they're not coming back until January or whatever. And so that might have got mixed in there a little bit, that we were doing that, but that's simply not the case. At this point, things can change. I don't see that changing because we realize if we do that, if we close and go full remote, we understand that kids need to be in buildings. They need teachers in front of them. That's the way that K through 12 education was intended and should be. And we understand that puts families in some really tough situations. And so again, we continue to monitor that. And, I wish I had a number to say, hey folks, this is the number that would really predict this or that, but we don't. The last thing I want to focus on is with the new DHM that's out and some of the activity guidelines. Just so we're all aware, we have had to reevaluate our basically our fan policy, attendance policy, and so now we're at 25% capacity, and it's household members only. And so what we're going to do here is get all our information out here within the next week, but you are going to see that it's 4 household members, and that's it. And so unfortunately, we're not allowed to have a student body come to a basketball game or wrestling or the one act performance. It's just the way it is at this point in time. So that would be household members only. So anyway, we're going to have to figure out a way how to, I suppose, patrol that, which could be difficult. But we just got to do this right. We got to make sure that we're doing our job to keep our kids in school and keep the spread at a minimum. So I think that's all I have today. As always, if you have questions for me, please reach out to me. I'd be happy to talk to you about all of this. Thank you.
Thank you, Mitch. I'm not seeing Brad on, but do we have any other K through 12 schools online that would like to provide a report? Okay. Well, I do know Southeast Community College, York Regional Learning Center does not have a report today. Emily, do you have one from York College?
I do have one from York College. As the newspaper reported on Tuesday, but people may not have seen because of the ice, we have not switched to entirely online virtual. We're still in a hybrid. We've just loosened up some attendance restrictions to give our students more options. We've just kind of expanded that hybrid if they wish to go home and now before Thanksgiving and do the rest of the semester virtually, they're welcome to do that. We've only had about, I think I have liberty to say this, 30 students that have taken advantage of that at this point. Some are still here because there are still extracurricular activities happening. But we did not switch to an all online setting. Like Mitch said, we are doing the not coming back after Thanksgiving. So that is still the same. Obviously switching to hybrid or just expanding that hybrid option got a little more difficult when all of main campus lost power on Tuesday. So thank you to NPPD for all their help with that, getting that back up so that our kids in the dorms could be warm again. Other things that we've done are fine arts. There's one act this week and a choir performance next week. Those will all be live streamed. So the public is welcome to go to york.edu/box office to reserve a spot to get the link to watch those events. Again, athletics still is at 25%, but those are all live streamed as well. So we just encourage you to check out our website if you still wish to view the things that our students are doing, because we are trying to make adaptions and just let our students still do their things and have their York College experience, and let people witness them, but just in a safe environment. So those are the big changes for us. We have not gone to all online. We still have today and tomorrow and then 4 days next week of hybrid. And then after Thanksgiving, we will be a week of all virtual and then finals. So if anybody has questions, you're always welcome to email any of us, call the switchboard. We're happy to help. Thanks, guys.
Thank you, Emily. I appreciate your update today. I'm sure everybody appreciates it. Okay, we will move on to local government sector. I know I saw Barry on. Barry, do you want to kick this sector off?
Sure, Lisa. Good morning, everybody. I'd just like to start out with what's been said too, and thank MPPD and also the city street workers and people out there that have worked hard beginning the cleanup of this ice storm that sure made a mess of things. And just wanted to mention that we do have the landfill open with no fees for people to take stuff out there. So I know this is going to take some time, so we'll keep evaluating that. But as of Tuesday, we are now requiring masks in all city buildings. We just feel that with everything that's being said, that's necessary. Really do think that everyone needs to realize that we're very close to a point where things start getting shut down again. And this isn't a political statement. This is trying to keep us from being shut down and open. So really want to encourage everyone to wear masks when they can't stay 6 foot from somebody, when they go into stores, when they're around a lot of people, and then avoid crowds and do all the things that are being said. These new health directives that came out did change things back on the restaurants. And I know our restaurants did a nice job of enforcing, and our bars did a nice job of enforcing those rules the first time, and we'll hope that they'll do that. But this is really an effort to stay open and keep people safe. And the numbers are really shocking of how much they've grown here in the last couple of weeks. So Laura, I know your people are exhausted, but hang in there, and hopefully everyone will help you guys out a little bit by following the rules and trying to make this a better thing. So with that, stay safe, stay healthy, and be smart. Have a good day.
Thank you, Barry. Do we have any other local updates? I know we have a couple communities online in the meeting. Okay, so we will move on to the faith, community, and nonprofit sectors. Does the Health Coalition have anything to report this week?
Good morning. Yes, we have a limited number of masks available still. We managed to get some more. If you have not yet received any, but you would like some, we can help out with that. Otherwise, we just want to encourage everybody on this call. It's got to be us. We've got to be the leaders who start asking people to wear masks, start asking people to distance. We want to encourage everybody to keep those best practices up. And thank you so much, everyone, for your leadership.
Lisa, we can't hear you right now. I think you're on mute. There you go.
Thank you, Laura. Thank you, Jake, for your report. Is there anyone else from the nonprofit or faith-based sector on that would like to provide a report? Okay, we will move on to business sector, and I will kick us off with that one. I do know that some of our businesses, retail service businesses, are requiring masks to go in and shop. I have also noticed that some are asking for appointments. I'm going to ask everyone to be respectful of those business owners' choices. You know, it's a decision. They're protecting their staff, themselves, their customers by doing that. If businesses have chosen not to, be respectful. Just remember, we're one community and everyone is making their own choices. Personally, from YCDC's perspective, both Deb and I are working at home, available via appointments. I have a couple today that I will be going out for. Derek is in the office. If you need me, if you need to meet with me, my phone number is 402-326-1125. I'm more than willing to meet with somebody. Our office staff decided to take precautions and working with our board president with that. Otherwise, just continue doing what you can. I do appreciate all the precautions that our manufacturers are putting into place. I know they've had several challenges since March throughout it. And we are moving into the shopping session, and I'm sure Madonna will touch on this with this upcoming event this weekend. But remember, start local. You know, Christmas shopping, if we can keep it here, we can make a really big impact on our retail sector. And with that, I will turn it over to Madonna so she can give the chamber's report.
Thank you, Lisa. Good morning, everyone. I definitely want to echo Lisa, and we're seeing everyone all over the place on their personal preferences, and just to continue that respect. If you don't follow that thought process, stay home or call them on the phone and do curbside. Be respectful. Then also, we will be, Rhonda's been working great with our retailers in preparation for the holiday season. And a lot of them wanted to make sure that they had very safe, comfortable environments for everyone to shop in. So our local retailers, being very aware of that, have opened up their doors. We'll be opening up their doors on Sundays for some limited hours, just to be able to continue offer their great product as well as their wonderful customer service. They wanted to let all the patrons know that those doors are open for extra hours. So if you do see us might have a few more people than what you're comfortable, you can come back on a slower day. Our office, I will be in the chamber office on those Sundays as well, just to be able to help accommodate those wanting to bring holiday rewards, again, just to keep those numbers at a very good, comfortable, managed small number. Small Business Saturday has been something that has been promoted through American Express for years, and the chamber has taken part in it for 5 years. And it is really a nice, robust day for our retailers. We are again promoting that. We are putting together 350 shopping bags that will have gifts for those that choose to shop at our local businesses. During that Small Business Saturday, we will also have funnel cakes being served by the Boy Scouts downtown. And in my opinion, a funnel cake equals a donut. So come out and have breakfast and support our Boy Scouts as well. Again, I also want to say that YCDC and the Visitors Bureau's phones are not working. They are our office mates. And so if you do need to get a hold of Derek, who is physically in the office, and Bob Sauter, who is also in the office, you are welcome to call our number at 402-362-5531. And we will be happy to connect you with them while they're going through some of their temporary outage. Again, we appreciate everyone.
Okay, it looks like we just lost Madonna. But as she was saying, our office lines are down. You can contact the chamber and they will go right across the hall and get Bob or Derek. I do know that Margaret Brink from the Four Corners Health Department Board of Directors would like to say a few words now. Margaret, are you available?
Yes, I am. Thank you, Lisa.
You're welcome.
I think most of you know who I am, but I'm Margaret Brink, and I've been president of the York County, the Four Corners Health Department, Board of Health. Your other representatives from York County are Jack Sykes, County Commissioner, and then Jill Fickinger is our MD, and Scott Weeding is our dentist on the board. I'm excited about what I'm hearing because I sit here at home, I don't go anywhere. And I'm proud of what I'm hearing from the leadership. And some of you are saying that we've got to do this, we've got to take the leadership. So my hat's off to all of you who are really pitching in to make sure that the people around you are doing what we need to do. I see the health department from a little different perspective, because as the board chair and those of us on the board, our responsibility is to make sure that they're alive and well. And it's been a real struggle for everybody in that health department, and they're not alone. It's national. Everybody's struggling. So I want to thank all of you for doing that, and really to model the behaviors that we know work, and that is to wear the mask. And I hope that the Ministerial Alliance will take that to heart also in the faith community, so that we're safe there and people can worship and be safe. Probably one of the safer places is schools, and they've got that under control because they're all wearing masks. So from the board perspective, thank you for all of you that are doing and taking the leadership. This is a real crisis. And we all come together when there's a storm, when there's a tornado or a flood or some other crisis, and that's what we have to do. So keep safe. And I like York, and I think York's a great town, and we've got a good county. So thank you for letting me just share some thoughts that I have going. So thank you. Bye now.
Thank you, Margaret. We appreciate your input today. It's good to hear that the board of our health department is happy with what leadership in York County is doing. I think that speaks highly of our county and the city of York and all the other communities as well. I have not seen any questions pop up in the chat. Now would be the time. If you have something, you can unmute, ask Laura, ask Mitch. I don't know if he's still on, Barry, whoever you have a question of. Otherwise, we will wrap this up. Okay. Seeing nobody unmuting, I think we're done. For those of you that are still doing storm cleanup, good luck. Have a great weekend and stay happy.
Thank you, Lisa. Thanks, Madonna.
Thank you, Laura. Really appreciate everything you're doing.
Ditto, back at you.